Liverpool, Heart and Chest Hospital, NHS Foundation Trust. Information for patients and carers, cardiac surgery. The Liverpool Heart and Chest NHS Foundation Trust Hospital is a no-smoking hospital. Please refrain from smoking on site. Contents. Introduction. What operation may I need? Before coming into hospital? After admission to hospital? Before the operation? After your operation? Discharge home. A guide to the first few weeks at home. Useful information. List of useful telephone numbers. Discharge information chart. Please bring this booklet in with you when you are admitted into hospital. If this becomes mislaid or lost, do not worry, but please let the staff know when you are admitted, and they will provide you with another copy. Introduction. This information booklet has been prepared to help you and your family understand more about the operation that is planned for you. It will give you general information about what to expect before coming into Liverpool Heart and Chest Hospital, the Trust, and from your admission to give discharge home or to another care setting. It will also give you some practical advice about what to do when you get home. Within the booklet are details of organisations and specialists that may be able to provide further information. You will find a list of useful telephone numbers at the end of this booklet, and you may find it useful to write down any questions you may want to ask during your admission or at your outpatient's appointment. At the back of the written booklet, there is a discharge information table, which you can ask the nursing staff to complete when you are discharged from the ward. The NHS commitment to you. When you're in hospital, this is what you can expect. To be treated with respect and dignity at all times. To have a clear explanation of your condition and the treatment options available to you. To be asked for your written fully informed consent to any operation or procedure. To see your patient records if you wish. To be sure that the information in your records will remain confidential. To be informed about different aspects of your treatment and what procedures are being carried out. To keep relatives or carers informed of your progress if you wish. Your commitment to the NHS. In return, the Trust asks you to provide us with the necessary information about your condition, symptoms or medication in order to provide appropriate care. Treat our staff with the same respect you expect from them. Help as far as you are able in feeding yourself, keeping mobile and your personal hygiene needs. If possible, arrange for your transport home. If possible, arrange with your family and friends to take care of your personal lawn. What operation may I need? You will already have had some investigations for your heart, and your cardiologist has recommended that you discuss having heart surgery with a specialist surgeon. You may have coronary artery disease or valve disease or both. There are brief descriptions following of the conditions and how we treat them. Coronary artery disease and bypass grafts. Your heart is a muscle and it receives its oxygen and blood supply through the coronary arteries. When these become blocked or narrowed, your oxygen supply is lessened and you have chest pain. The surgeon will use one of your other blood vessels as the graft. This will be taken from either your leg, your arm, or an artery that runs just behind the chest wall. During bypass surgery, one end of the graft is attached to your aorta, the main blood vessel that carries blood away from the heart, and the other end is attached to the blocked artery beyond the blockage. Separate grafts may be used for each of the arteries that need bypassing. Valve disease repair and replacement. Your heart has 4 valves, which make sure that the blood flows through it and around your body in one direction. These valves can become damaged or diseased. When this happens, they can either leak or become blocked. This causes you to feel unusually tired or breathless. The most common valves affected are the mitral and the aortic. If your valve is being replaced, there are 2 types, tissue and mechanical. Each type of valve has advantages and disadvantages. If you have the mechanical valve, you'll need to take a blood-thinning tablet, usually warfarin, for the rest of your life. If you have the tissue valve, it may need replacing after approximately 15 years. But there may not be a need for you to take warfarin for life. Your surgeon will discuss both options and help you to decide which is the best option for you. Aneurysm repair or replacement. The aorta is the main blood vessel that carries blood out of the heart and to the rest of the body. Swelling of this artery is called an aneurysm. Once aneurysms reach a particular size, there is a risk it may tear or rupture, which is life-threatening. Aneurysms of the aorta can occur along its length. Aneurysms of the aorta can occur along its length in areas known as the root, ascending aorta, arch of the aorta, descending aorta, and abdominal aorta. The surgeon may approach your aneurysm either through your breastbone at the front or through your ribs on the left side of your chest. The aneurysm will be replaced with a graft or tube which is made of a material called dacron. Sometimes your surgeon may also need to perform a valve replacement or coronary artery bypass graft, previously described. At the same time, in some patients, the aneurysm can be treated by inserting a graft called a stent to cover the aneurysm from the inside. This is inserted via the groin in much the same way as a coronary angiogram is performed, although stenting an aortic aneurysm is a more complex procedure. Benefits and risks of surgery. Benefits. Coronary artery disease bypass grafting. The intended benefit of surgery is to help alleviate the symptoms associated with your heart condition, including improvements in your angina symptoms, improvements in your ability to exercise, reduction in the risk of future heart attack. Valve disease repair or replacement. The intended benefits of undergoing surgery for valve disease repair or replacement is to help improve symptoms and prevent future heart failure. Aneurysm repair or replacement. The intended benefits of surgery or stenting an aneurysm of the aorta is to prevent tear or rupture which is life-threatening. Sometimes large aneurysms can cause chest pain or shortness of breath, and surgery is intended to improve these symptoms if they are present. What are the risks involved? As with all surgical procedures, heart operations involve risks to the patient. These risks vary according to the type of operation or procedure, your overall health and your individual heart condition. Your consultant will discuss this with you so that you are fully informed about the risks and benefits of the procedure. When you meet with your consultant, please feel free to ask any questions you may have about the risks involved. Alternatives. Your surgeon will discuss with you any alternatives for treatment that are available, including the option of not having surgery and continuation of your... Before coming into hospital. Pre-investigation clinic. You will need to have some investigations before coming into hospital, and these are some of the tests that may be carried out. Blood tests. A blood sample is taken from your arm and various tests are carried out, including identifying your blood group. Chest X-ray. This will look at the size and shape of your heart and general condition of your lungs. Pulmonary function tests. These are breathing tests which measure how well your lungs are working. Electrocardiogram, ECG. This shows the electrical activity of your heart, recording your heartbeat and rhythm. Swabs. These will be taken from your nose, throat and groin to check that you do not have any infections prior to your surgery. You will be given an information sheet regarding this. Pre-admission clinic. As part of your preparation for surgery, you will be reviewed by a clinical nurse practitioner who is specially trained. This assessment will take up to 2 hours. A nurse will take a full history, perform a clinical examination, assess whether you require any extra support or have any disabilities, explain about the procedure and your hospital stay, explain about the recovery period following surgery, discuss cardiac rehabilitation, repeat any investigations if necessary, give advice on your medication, including which tablets you should stop prior to coming into hospital, discuss any concerns or answer any questions you may have. Advise you to visit your dentist before valve surgery. This will reduce the risk of infection on your new valve. Discuss your expended length of stay and approximate discharge date. Arrange any additional help you may need, such as a social worker or dietitian referral, or advise you who to contact for advice about stopping smoking. The nurses are available to help and support you, so please feel free to ask them any questions you may have. Whilst you are waiting to come in for your operation and have any concerns about your illness condition, you can contact one of the clinical nurse practitioners on their helpline number by telephoning 0151 600 1298. Smoking. Smoking advice. If you are currently smoking, it would be best if you could give up smoking for at least 3 months prior to your operation. Giving up smoking may not be easy, and you'll need support and encouragement from your family and friends. We have a smoking advisor to offer you further help, and you can request a visit when you are in the outpatients department, or alternatively make an appointment by telephoning 0151 600 1455. What next? You will have already been given a date for your operation, or you will receive it shortly. Your letter will tell you the date and time to come into hospital, the name of your consultant, and where to report to on arrival at the hospital. Most patients are asked to attend the admissions and discharge lounge to be admitted. You can eat and drink as usual on your day of admission, unless specified otherwise. Please bring the following items with you when you come into hospital: all your tablets in their original bottles or packets, which you'll be asked to hand to the nurse on your ward, your admission letter and this booklet, nightwear, dressing gown and underwear, flat, comfortable full shoes or full slippers, small mirror, towels, pen, tissues, small change for the phone, papers, etc., a wash bag containing toothbrush, toothpaste, denture box, brush, comb, glasses in their case, if you wear them, shaving equipment, soap, flannel or small sponge. It would be helpful if you would label your denture box and glasses case with your name and date of birth before you come into hospital.